What is obsessive compulsive disorder? So what it is, I'm going to show you a graph here that I found online which shows the ages of individuals with OCD, not by sex or race. So the ages for 18 to 29 is 2.0% of individuals have OCD. Ages 30 to 44, 2.3% have OCD, and ages 45 to 50, 1.3% have OCD. And ages 60 and above have 0.7% of OCD. So what is obsessive compulsive disorder? It is an anxiety disorder, which means individuals with OCD experience intense, frequent deliberation, anxiety as a result of their obsessions and resort to repetitive, time-consuming, compulsive behaviors as a way to quell that anxiety. So in order for someone to have OCD, they must either have the obsession part or the compulsive part. And how someone can know if they have OCD, they'll go to a doctor and the doctor will perform some tests on them. And some tests include either a physical examination, laboratory tests, and also a psychological evaluation. So what consists of the physical exams is, of course, your height and weight. It also includes all your vital signs. It will include to check how your heart and your lungs are, and also they will check your abdomen as well. With laboratory tests, what will consist from laboratory tests will be they will do a complete blood count test on you, and they will also do an alcohol and drug screening. And also they'll check your thyroid to see that it's functioning correctly. For the physiological evaluation, what that consists of is the doctor, mental health professor will actually ask you how you've been feeling, how your thoughts are, and also how long you've been feeling these symptoms, how severe they are, and also to see if you've ever had this type of episode before. So for someone with OCD, you must have you must meet certain requirements, either the obsession part or the compulsive part. So the obsession part, the requirements may include persistent thoughts, impulses, or images that are intrusive and cause distress. The thoughts aren't simply excessive worries about real problems in life. And for the compulsive side of the criteria, these ones include repetitive behavior that you feel driven to perform, such as hand washing, or repetitive mental acts such as counting silently, which also means someone with OCD might have to walk around their house 3 times before they get in their car, make sure their door's unlocked 10 times, just some type of routine. So we have medications to help you with OCD, and these types of medication include either a psychotherapy or medication, or they can include psychotherapy and medication together. The psychotherapy part, actually, what this does is it teaches the person different ways of thinking, behaving, and reacting to situations that help him or her feel less anxious or fearful without having obsessive thoughts or acting compulsively. Some medications include SSRIs, which are either Prozac, Zoloft, or Paxil. These medications are antidepressants, but they also help with OCD. These drugs take about 12 weeks at high doses to fully reduce your symptoms, so it is important that you consistently take your medication in order to help you with your OCD conditions. So to conclude with my presentation, I'm going to show you a picture that I picked out to kind of show you how a person with OCD might feel versus a person that doesn't have OCD. And that includes hand washing, as you can see. Everything in the red area is areas that remain only dirty after hand washing. On a regular person, you can see. Sometimes mist is the blue area, and this like peachy color area is areas that you've cleaned correctly. So a normal person might see their hands like this, but someone who's OCD might see their whole hands dirty even though they've washed their hands multiple times, 3-4 times. They still might see their hands really, really dirty. So it's just how it affects a person's everyday life. OCD is a serious condition if you don't get help or medication. And that's all I have for my speech. Thank you.